Welcome to the Dental Handoff. I am Dr. Kelly Tanner, and today I have my bestie, Dr. Elaine Bylis. Hello, my friends.
The girls are back.
The girls are back, and they're gonna
Back
get
again.
in trouble. I don't know if you guys remember. I remember it was it was the first time I met you, Elaine, during COVID that time with Kirk Barrett. And Kirk Barrett, and then also with Zyris, with Roe, we did Flossy Ladies.
Yes. And it feels so good to be on this side of the interview.
That's right. You were the mistress of ceremonies and asking all the questions.
Yes.
So how far we've come, but I finally got to meet her whole body in Ohio. Was that where we were? Columbus. So we met at that meeting, and it's so good to have you on. So I said, you must be on the podcast because you guys, she has such a cool story. So Elaine, let's get to it. Why dentistry for you? Why dentistry for you?
Ooh, okay. So we have some time. So you're going to get the full story. Are you ready?
Let's hear
it. So I grew up knowing that I love dentistry. I love the dental office. I would gravitate toward the dental office. So my dad's a dentist. And so say there was a snow day or a day off from school, I would choose to go unpaid to work at the dental office. So at 12 years old, instead of playing out in the snow with my friends, I would choose to spend the day with my dad and file charts or chairside assist or clean the rooms or whatever he needed at the office because I just loved being there. So I was like, okay, I love dentistry. I think I'm going to be a dentist. I see what my dad does for his patients. Like my dad's patients come in and they're like, he has changed my entire life. I'm so grateful for your dad. And so I loved seeing what he was able to achieve in other people's lives. So I was like, okay, I love dentistry. I think I'm going to be a dentist. This is like 12 years old. And I would tell all my friends, they'd be like, what do you want to do? I was like, I'm going to be a dentist. And they're like, who put you up to this? Why would you want that? Do your parents force you? I was like, no. Like, I want to be a dentist. So anyway, so I knew that was a field that I wanted to join, but then my mom was a software engineer. So she retired, but for I think 30 years, she was a software engineer for Verizon. And let me tell you, my MySpace was one of the most perfectly programmed MySpace pages. I would sit up all night just doing the coding for it. And so I was like, I'm either going to be a dentist or a software engineer. And so finally, when I was like 12 or 13, it was take your child to work day. And I had spent plenty of time in the dental office. And so finally I was like, you know what? Let me check out what mom does. Because I was actually, in a way, kind of leaning toward being a software engineer. So I went to work with my mommy and I sat in her cubicle for 8 hours. And you have to whisper. You can't talk very loud. And apparently she had this like amazing and exciting day. And she was so happy with how everything went. And I was miserable. And that was the day that I knew I have to be a dentist.
Okay.
And I think when most people see me as a dentist, they're like, this is the field for you. You know, it's so cool that I get to go to work. I work with my hands all day and that's my job. And it's just so much fun. I get to change people's lives and make them smile and give them confidence. And so I absolutely made the right decision.
Yeah, so you paid attention to how it made you feel at the end of the day at 12 years old, 13 years old.
Yeah.
That's so crazy. Do you still have your MySpace account?
You know, I bet you could find it. And it was super cool. So it was all black. And usually when you scroll, the picture on your MySpace would scroll with it. And my picture was a pufferfish because I scuba dive. So there was a pufferfish, but instead of the pufferfish scrolling with the page, I was able to lock the pufferfish, but all the text would scroll on top of it.
That is fancy. That is so fancy.
I know.
Things we didn't know about you.
Oh, and the music on my MySpace was Rod Stewart, Do You Think I'm Sexy?
You want my
money and you think I'm sexy.
Oh my gosh. I'm just getting this nice visual here. So you decided, all right. So then you went on straight to dental school. So you decided from there.
Yep.
That's what you wanted to do. You went to dental school. Did you go right out into practice?
Yes.
Okay.
Yes. I knew I was going to be a dentist. I knew exactly what kind of dentistry I wanted to practice. And I had been around it so long that I didn't feel like I needed any additional training. I felt like I was ready to go right after dental school, straight in. The other really helpful thing that I had, which I would recommend to anyone who wants to take that plunge and just go straight into practice, is I did have a mentor because I work with my dad. And so I think it would be hard to do what I did without someone kind of overseeing you. But you can finish school and have that autonomy as long as you have someone to just kind of keep you in line and just make sure everything is going well.
Yeah, that was my very next question or comment. Like you have the ability to have your dad there as your mentor, and you still do because you work alongside of him. So how awesome is that? When you graduated, what was the thing, and you went into private practice, what is the thing that you feel like that you may have been least prepared for?
Great question. Actually, you and I, we were talking a little bit ago about kind of some of the things that I'm acclimating to, and as I'm starting to get into more leadership roles in the practice. So the dentistry is not necessarily the hard part. It's kind of being a part of that team culture. Everything that you're teaching are the things that I think they don't really teach you in school. And so the business and how those things work, and, just working with the new team, like all of that were the things that were the hardest for me, just because I have no training in that type of thing in school. And so I came out and I was like, let's figure out. So the first 5 years of practice were when I really was working on my hand skills and building my dental skills. So I was very lucky that I had those 5 years. Dad was kind of overseeing, and now I'm starting to step into some of the more kind of leadership roles. Cool. Just because, that's something that I like to learn as well.
Yeah, because even with the business side of things, not even the human part of things, right? Just the business and how much time you need to do a procedure, to do a procedure and do hygiene checks. Like I joke about it all the time because, we bust dentist chops about, okay, 45 minutes later, you're coming to do an exam. We say that lovingly. Yes, it's a pain point in what we're doing, but I can't imagine being you and having to get up from a prep or whatever it is that I'm doing and sever that focus, or thinking about that or not, and then come in to have a whole other conversation or 2 or 3 other conversations.
Yes. And it's something, and I'm trying to do better because like I see it from the hygienist perspective of, you're like, hey, this patient's got to go. I need this exam. There's only a few more minutes in this appointment. And you come in and I'm like, sorry, I need a few more minutes. But then I see it from my perspective of, I'm knuckles deep in a root canal and I cannot find this extra canal and I'm sweating and I'm like, oh my gosh, this is so difficult. And then I have to get up and be like, hi, Mrs. Jones. It's so good to see. So it's a lot to kind of compartmentalize, but I'm learning to do better with that because it is difficult. And I am starting to see it now from everyone else's perspective, because for the first few years, I was so focused on building my skills that I didn't really see from other people's perspectives.
Yeah. So what do you think changed for you? Because when you say I'm getting better at it, like what are a couple things that you've said, okay, I that you knew in a moment, you were like, okay, I am getting better at this, that it occurred to you. What happened? Do you remember?
A couple things. So first off, I have become a better clinician in the past few, like I'm better now than I was a few years ago. So I think I'm a little bit more confident. Things go really smoothly now that maybe wouldn't have a few years back. But then also just in an attempt, I'm learning that Dad is not going to be with the practice forever. And so I'm starting to learn that I need to step up and I need to be a good leader and work with our team and do a really good job of that. And so with that, I think came some empathy of starting to see what everyone else's experiences are. Now, I am fortunate because I was raised in a dental practice. And so I had done almost every job except for being the dentist as I was growing up. So I had worked in reception. I worked as an assistant. I spent entire summers just dental assisting. And so I do have that perspective that I think is unique in our field that not everyone gets. And I don't think that's replaceable. And for any young dentist or like prospective dentists watching, learn the other parts of the office and actually work them and see what it's like. But yeah, that's kind of what I've been working on. And I think knowing that, you know, things are starting to fall more on me, I'm trying to really do a good job of being there for everyone and supporting everyone the best that I can.
Yeah. I didn't mean to put you on the spot with that, but I thought, okay, you had an aha moment. It was because sometimes I'll be, okay, why does that feel different? I'll think that to myself.
Yeah.
I think too, you made a really good point, Elaine, and this is one of the things that I recommend to the practices I work with, or just in general, is that it helps so much to know that other person's perspective. So to do shadowing in another person's role, to be alongside of the treatment plan coordinator, for each person to have that experience, even if it's for 3 hours 1 week, and people just take turns, you're rotating and you're observing in different positions, to be able to understand what that is. Because I think then you get a sense of, I was joking about this the other day when I was speaking in Vancouver, but the front office are going, okay, why is the hygienist running so behind again now? And we have iTero and we're talking, but then it's a trickle down effect, because if we're waiting, then the patient's waiting, and then it just snowballs, right? But they don't know that.
Yep.
Sometimes they don't know what they don't know, unless there is a path of communication, and what's that structure in your office, and when do you notify, and all of those things. But it helps to have to hear those conversations and what happens in the back. So then you know how to help, you know how to bridge that gap, you know how to support the other team member in that way. Because I think human nature is that human nature in general is that we all can feel like when we're frustrated that we're doing more than the other person, right? It's like, why are they doing that? Well, I'm over here doing all of this. And that causes friction in dental practices. And so I feel like, and I've can realize too, and I know because I've seen it, if other people take the opportunity to observe those other positions, they can empathize with them. So I think it's amazing that you have that perspective to lend to your entire practice.
Yes. And I'm not perfect at any other position, right? So like if I hop in and I assist nowadays, I will start doing like the dentist role while I'm like, it's not good anymore, but at least I understand kind of what goes on in their position. Oh, and like the front desk, like the phone is ringing and they're trying to do a treatment plan. Like there's so much going on in all of these positions, and it gives me so much perspective and empathy. So yes. And the other thing that I did that I loved that I did is I had worked in other practices. So I actually, so I haven't just seen my practice. I actually worked at another practice, and I could see, okay, what works, what doesn't work. And it gave me an appreciation for my dad's practice and kind of the culture we have there.
And he's probably shared a lot with you for the things that, trial and errors that he's had over his time of practicing. And you can step in and say, okay, help me understand that too. So you have that edge, if you will. And then what about the dentistry portion of things? What's your favorite procedure to do, Elaine? I know that you're famous and infamous, but what's your favorite thing to do in practice?
Ooh, okay. So I love cosmetics in general. So anything like Invisalign or bonding or porcelain veneers or anything that makes someone look better and feel better. It's fun to do it, but it's also just fun to see the result. The thing that we are most known for is our composite veneers. And so it's kind of cool. We'll actually have patients sometimes travel to us for that procedure. And it's kind of cool because with the composite, I'm building it myself. And so I know that it's my vision created on the patient's mouth. And then when they leave there smiling, I can be like, I did that, like that. Yeah. And it's very rewarding to be able to do that.
Do you give them, I know there's some programs that have like Smile Architect. Do you give them a visualization, a representation of what they might look like?
I love that you asked that. Okay. So I have my own super secret, it's not a secret, proprietary way of designing smiles. And in a way it's rudimentary, but I like, for me, I like my way. So the way that I like to do it is I like to use literal Photoshop, right? So like the same thing you would use to edit a photo. And I got the idea from the great Ed McLaren. So he was the one who kind of planted the seed in my head of like, hey, you can use Photoshop to simulate smile designs. But then I kind of made it my own proprietary kind of method. And so what I'll do is, and I don't even charge for it. I'm like, anyone who wants to see what their smile can look like, come and see me. I can take someone's photo onto my computer and then I can go in and play with the shapes of the teeth to show them what it will look like. And I'll usually present several different treatment plans. And the reason why I like my way of doing things is because you can see me do it. I'm not just plugging teeth into a program and just copying and pasting. Like I'll actually go in and warp the teeth. And so the patient can see that I have an idea of exactly where I want these teeth to go.
Wow. I did not, that's funny because I asked you this and I had no idea that you did that, of course. Yeah. How long does that take you to do that?
5 minutes.
Okay.
For no charge.
Okay.
And it's really interesting. And then it's cool because I can turn it on and off in someone's photo. It looks pretty real. And I can show, okay, these are the principles of smile design. Like this is why your teeth, they look good, but why they can be made better with my design. And it's different for everyone. So like the teeth that look good on you aren't going to look good on me, aren't going to look good on my dad, right? It has to be custom for the person's face.
Right.
And it's kind of cool because you can go back and look at my previous cases. So you can look at the actual final result of that case and then go back and compare it to my Photoshop mock-up. And it's almost like you're looking at the exact same photo.
Wow.
So I've gotten to a point where it's highly reproducible, which is crazy because the Photoshop is 2-dimensional and I can recreate it in 3 dimensions.
Yeah. Well, then I think too, by you doing that, you know your own capabilities, so it's not like AI, because sometimes AI will attempt to do that, to do what you're talking about, and it looks out of whack and it doesn't look natural. And you're like, wait, everything but that. And then, but your own limitations, your strengths, and how much you can build things out based on materials you're using, So it makes sense that you can do that.
Yes. And it's good to prove to myself that it's possible. So what I have come to learn from all of my old lady years of doing this, I've been practicing for 7 years now. But anyway, there's never been a time where a vision that I created on the Photoshop couldn't be recreated in 3D. So I can do this like marvelous 2-dimensional stuff, but I know if I can do it in 2 dimensions, I can do it in 3 dimensions. And so it kind of proves to myself there's always a way. But I would be nervous if I just cut and pasted an AI set of teeth on someone. I would be nervous that it wouldn't actually be possible in real life. And I don't ever want to promise something to a patient like, hey, I can make it look like this, and then have it not be real. So, and it also manages patient expectations because I can have a conversation with them of here's what I see myself doing, but really you need a gum lift and here's why. And I can show them with and without the gum lift. So it's a really good conversation tool and it allows us to get on the same page. And I know if a patient approves of Photoshop, then I'm clear to just go and do the case. Like they know what they're going to be getting.
Yeah. And you have the confidence to know that you can deliver what they're getting with your skills, your techniques, your materials that you're using, based on all the things.
Yeah. And then the crazy part is, because I'm a maniac, I'm a lot of fun on the weekends. So on the weekends, I hand wax the cases. So the way that I recreate it is I use the Photoshop to guide my hand wax up. So I take stone models, and I know there's faster ways to do it, but I like to have that control over the case. I don't want a lab to do it. I don't want a computer program to do it. I want to do it because I know it's in my head and I can figure it out. And so what I'll do is I'll use the 2D to guide my wax up, and that's the 3D model that I then use to actually do the case.
That is so cool, Lane.
Thank you.
Wow.
I'm glad you think so.
Well, we're nerding out here, it's all for the love of, right? But you do, because if you think about some of the reasons why patients may not have the satisfaction and the dentist may not be meeting that expectation of the patients, it's the final restoration, right? It's the color, it's the shape, and you can control all of those variables by doing it in-house.
Ta-da! Yes. And that's why I choose to keep doing it, because I know there's faster ways. I know I could plug it into a computer and have a 3D model printed for me, and it would save me a lot of time. But I love knowing how predictable it is the way that I've been doing it. And I like having that control. Yeah. You're absolutely right.
Yeah. Because I'm just, kind of like backing into it of, it's not the right shade, or the margin isn't quite right, or it's catching too much here, or it's open too much there. You can just be like, okay, cool. I'll just fix it right here. Let me go talk to my lab really quick. Hey, self, let's do this.
Yeah. And I never have to send something back, because if I'm doing a composite, if there's something that we don't like, I just fix it. Like, I don't have to box it up and send it back to a lab and bring the patient back and do another insert. Like, I just fix it right there.
So the patient never leaves without something in their mouth.
Oh yeah. Mm-hmm.
Okay. That's big. That's huge. So, all right. I know that at Ohio, you talked about this, your technique and what you're doing, and you're becoming pretty popular. So I can say I knew you when. I knew her. Remember all the Mark Hyman always tells me that. Remember all the little people, like Dr. Mark.
That's so sweet. Yeah, we all know Dr. Mark. He's a celeb.
He really is. He's a giant for many of us. He lifts everyone up. Mm-hmm. But are there any words like of advice you would say for a person who wants to do the technique that you're using? Like, how would someone start, or even with what they have and they're doing simulation mock-ups, how would they back into what it is that you're using?
Oh, okay. Well, for composite, my biggest piece of advice, and dentists are going to hate this, but my biggest piece of advice is learn to do it in wax. Like, do your wax ups. Don't send it, because the wax up is the practice round. That's when you figure out, and the biggest, I think, obstacle for a lot of dentists for doing composite is they don't like the idea of having to shape it themselves. Mm-hmm. And so if you just sit and do your own wax ups and do the practice, and it's tedious, and I don't always love spending my weekends at the dental office doing wax up, but I believe that the reason why I've become good at it is because I've had those practice rounds and I keep creating teeth by hand. And then your other question was about doing the wax ups.
Yeah. Like, how would they've gone, let's just say that they use Smile Architect or another smile design program or whatever to approximate what it's going to look like for that patient. And they're sending stuff out to the labs, or they're milling in the office. How do they even get started? Because I know that you guys, I know I've seen it in dental schools because I've taught at dental schools. I've seen you with your wax ups, right? But I don't know how common it is for a doctor to still do any wax ups after they graduate. So how do they go back to being good at doing wax ups is the question.
Great question. Okay. So I would say two parts of that. So first off, look at teeth. So when you're doing a hygiene exam and you see a patient with a really nice smile, look at their teeth, see what you like about the shapes and where all the different parts of the teeth go. And then, of course, going to start the wax ups. Now, you mentioned Smile Architect, and that's kind of like the Invisalign version of what I'm doing in Photoshop. And really, if you're using Smile Architect or you're using some kind of facial-based treatment planning, that's the first step. And then you figure out, okay, where are the teeth getting longer? What's getting shorter? Where are we adding to these teeth? And then figure out from studying teeth in real life, how you can recreate that on their models.
Okay. So you're the expert in that, so they can contact you. They could be like, I'm going to talk to Elaine. So you're going to be doing all the things and teaching everyone all the things.
I would love.
Yeah.
But yeah. If anyone watching, if you ever have questions about this, reach out to me. I will get back to you. I would love to help.
Yeah. Because you're super responsive.
I am.
So your dad's still there. You're practicing. He's still mentoring you. Do you see yourself evolving into other procedures? Or, I know that you're still doing a lot of different things and this being your favorite, but do you see as like your next favorite thing coming up for you?
So great question. Our practice is cool because we do everything. So I'm placing an implant tomorrow. We do gum surgery. We do Invisalign. We do veneers. We do root canals. We do every procedure. So actually, to answer your question, I think I'm starting to scale back. Instead of adding procedures and trying to take on more, I'm actually starting to realize which ones bring me joy that I can focus on, and then which ones stress me out a little bit. Maybe I'm not going to do as much. So a very exciting thing in my life is I learned that if it's a straightforward root canal, I'll do it. But once it starts having multiple canals, I'm like, you know what? Let's get you over to the specialist. They're really good at root canals. So that's actually been, and that has been bringing me lots of joy in life. And so kind of figuring out what my niche is, what I'm good at, and then sending out the things that don't bring me joy.
Yeah. And I think that's the natural evolution from speaking to a lot of doctors, but some docs still will do those things because they're still challenging themselves or they haven't talked themselves completely out of doing them forever. So it sounds like that would be advice that you would give people too, is if you're realizing in the middle of it, like if extractions are not your jam or molar endo is not your jam, refer it out.
Get it out.
Yeah.
When in doubt, get it out.
Refer it out.
Bye. Oh my gosh, Dr. Sung, our root canal, he's going to love you. Go. He's going to do a great job. He loves root canals. I don't.
Yeah, that's what they love. There are people for that.
Yeah.
All day.
Yeah. It makes me so happy when he does the root canal.
Yeah. And I would feel like I would be that type of dentist too, who would want to learn all the things so I would know different parts of it. Because I saw practicing with the first dentist I ever practiced alongside with when I was just a little baby hygienist, that they would go to tons and tons and tons of courses and they would come back and we would start to implement different procedures. But then I'm still wondering, how do they know how much time that's going to take? In my mind, from going from school to going into practice, how many units do you need when you're learning? And because you're always learning, I guess you just give yourself more time for that with newer procedures.
Yeah. Yeah. And I'm grateful that I'm in a position where I've done I've done every procedure. I've done a lateral sinus lift. I've done everything. And I figured out, first off, what goes into it. So I have an appreciation for what these specialists are doing. I understand how crazy these procedures are, but then I love being able to know what I'm good at and then refer accordingly.
Yeah. And I think that you're speaking to a really good sage piece of advice in the office, because what I'll find is that sometimes when people are dissatisfied or they're feeling burnt out, dentist, front, assistants, hygienists too, I'll say, what do you not enjoy? Do you enjoy, from a hygiene perspective, do you love doing scaling and root cutting? Do you love treating that? Do you love doing peri maintenance? And some are like, no, I absolutely dislike it with a passion. And it's okay, you probably should talk to somebody about that. There's probably other hygienists in your practice who love to it. I love doing both because I love creating smiles. I love I love all of it. Right. And being in one all day, I would be like, oh, but I missed that one over there. Do you feel like that? And so knowing when, I think this goes back to your childhood when you sat next to your mom at her office and it didn't light you up. right?
Yeah.
So pay attention to that. Pay attention to what lights you up in your life and know that at any time you can pivot on that and use that as your power to say, I'm not choosing that anymore, right?
Love that.
Yeah. So go you. I'm so proud of you. Well, any final words that you would like to say to our viewers, our followers?
Thank you all for watching and for being a part of this podcast. Kelly Tanner is one of the greatest people, and I'm just so honored to be here today. Thank you.
Oh my gosh, you are one of the greatest people. Her energy, you guys, when you see her in person, it just like comes out like a force field, like 10 feet wide. I'm like, ooh, it's so good. So good, my friend. If you guys want more of Elaine, and because I know you do, look in the show notes, her Instagram, all the things down there. She posts some amazing cases on Instagram. Is going to be posting more, I hear.
Oh, yeah.
Little birdie told me. So thank you all for what you do. Thank you for being a part of our community. You know, I always ask, go on to Apple Podcasts, 5-star rating. Elaine, 5 stars. Tell them 5 stars. Rating,
5 stars. 10 stars.
10 stars. Oh yeah. We need to start a whole new thing. And then if you're on YouTube, like the subscribe button right now, press it, push it. So other people who love shows like this, it recommends it to them. Thank you for the lives that you touch. We will see you soon. Again, my friends, sending love to you. See you, Elaine. Thank you.
Love you. Thank you for having me.
Absolutely.